Welcome, everyone. Thanks for being here on such a beautiful sunny day. After all the weather that we've been having the last several months, we're very fortunate today to have such beautiful weather. I'd like to take a few moments before we begin to introduce a few special guests that we have here this afternoon. And if, as I mentioned, your name or your group, if you could please stand so folks can recognize you. We have with us State Representative Dave Frizzell. Dave? City Councilman from Greenwood, Brent Corey. And I might mention that Brent's real role in life is to be the husband of one of our PCU nurses, but anyway, Brent is with us this morning. I'd like to welcome the network board members and committee members from the Community Health Network Board and the Community Health Network Foundation. If you could just stand for a second. Included in that group was our CEO and President, Bill Corley. Bill? In addition to that, we have representatives from RTKL, our architects. Rollins Construction Team. BSA Life Structures. I think there's someone from BSA over here. I know we have several of our physicians in the audience. There we go. And of course, all of our employees, friends, and visitors today. Thank you for being here. This is an exciting day for Community Health Network as we break ground on a $130 million expansion of Community Hospital South. This is the next evolution for the Community Health Network. Last couple of years, we were dealing with the Northeast Corridor and the expansion and next evolution that we had up there with Community Hospital North. We are now beginning to address the needs here on the South Side through this next evolution. This expansion is a result of the growth in the population on the South Side of Indianapolis. Just as the network has expanded last year to meet the needs of the Northeast Corridor, we are now expanding to meet the needs of the South Corridor as well. During the past 2 years, inpatient volumes at Community Hospital South have increased by 20%, and we know that this is a direct result of the growth in our market area. White River Township in Johnson County is expected to have continued dramatic growth in the next 5 years. Population there is expected to be more than 40,000 by the year 2010, and Greenwood's population is expected to grow by 9%. Franklin, which includes Bargersville, is also expected to increase population by nearly 12%. Franklin is expected to have a projected increase of 15% in need for cardiology, pulmonary, and orthopedic inpatient services. Between 2007 and 2012, the percentage of the South Market population between the ages of 55 and 65 will increase from 10% of the population to more than 12% of the population. And as we all know, myself included, as we age, we need more health care. So we want to be here to provide that health care for the future. In Greenwood and Whiteland, there is expected to be a significant growth in the need for many of the health services we provide, including cardiology and orthopedics. As you can see, we are growing along with this community.